Hi, my name is Nina. I'm a family nurse practitioner, and as an advanced practice registered nurse, I have the education and clinical practice requirements to provide services in the community to improve the overall health of our community. So, a business idea I'm pursuing is an intravenous IV therapy mobile health unit. And if you're familiar with the concept of IV therapy, or if you've ever seen an IV drip in a hospital, the principle is the same, but the goal is slightly different. So, our intravenous therapy mobile health unit will be traveling throughout the Central Valley, and specifically, we'll be focusing Fresno and Clovis area, and we'll be going to different gyms and sports clubs, as well as businesses of various sorts, schools such as colleges, and also farms. So, the mobile health unit will administer IV therapy for different occasions, such as after sports practices, for athletes, and we'll even be going out to farms and fields to provide IV therapy for our farm workers. And the goal of this business venture is to ultimately provide IV hydration and improve the health of the community through an alternative approach in medicine. So, IV therapy provides therapy and treatment that is administering a variety of vitamins, minerals, and also electrolytes straight to the bloodstream and into an individual's circulatory system. And because of this, it's a very fast acting therapy if you compare it to um, taking oral supplements to treat any deficiencies, because IV therapy, it bypasses your digestive tract, it goes straight into the bloodstream. It's very fast acting. You'll see benefits of it pretty quickly, relatively quickly. And even though traditionally IV therapy is used in hospitals, it can also be applied to the non medical market. So, specifically here in the Central Valley, we have extreme heat levels during our summer months, and a large number of activities are still going on even with these heat warnings. So, for example, farm workers are still out in the fields um, providing fruits and vegetables to grocery stores and making sure that there's food on our tables. That way we don't go hungry. And also, athletes are also practicing outdoors, and their games are typically outdoors as well. So, because of them being outside for a prolonged period of time due to the activities that they're involved in, they're perspirating and losing a lot of water through sweat. So, IV therapy has actually shown to have numerous health benefits, such as a stronger immune system. We can infuse vitamin C, um, and that will help improve the overall immune system. It also improves athletic performance. IV hydration also helps increase recovery time, restores lost nutrients such as electrolytes when athletes and farm workers are sweating and losing a lot of water. It also increases energy levels, improves dehydration, it improves the skin, and it eases headaches and hangovers post alcohol usage, and it enhances one's concentration. So, overall, IV hydration therapy can prevent and lower hospital admissions related to heat stroke and dehydration during the hot summer months in the Central Valley. And this will also be beneficial for our hospitals because they won't be having patients coming in with these issues and taking up hospital beds for someone else that is probably a little bit more critical, and these symptoms could have been avoided if they had the appropriate measures and or therapies in place to help prevent them. So, the easily foreseeable barriers are that there is a low public awareness for the benefits regarding IV therapy. So, a lot of our time and money will need to be spent on promoting the business and marketing, and this is solely to help educate the public regarding the benefits that IV therapy truly has, compared to taking oral supplements to help with any deficiencies that they might be going through. Also, a collaborative agreement will be needed for me as an APRN, as a nurse practitioner, and I would need to work with a medical director since the state of California does not currently allow APRNs to practice independently. So I will be needing to have some supervision from a medical director. The registered nurses that we'll be hiring, they'll be required to take IV training and certification courses, and this is essentially to have the most highly skilled and knowledgeable staff performing venipuncture and infusions, and to minimize any discomfort from the procedure to our patients, and to prevent anything such as hematomas, blown veins, anything like that that may cause our patients discomfort or pain. Another barrier is sometimes the cost of the IV therapy might not be covered by insurance unless it's done for medical reasons. So we really want to make sure that our therapy is feasible and affordable for our patients. That way they truly can have access to this therapy and have the benefits that IV infusions have associated with them. Policy and licensure. Our business will have to have a city and county business license as well as a mobile vendor license. This will include zone clearances for parking where we can and cannot park, as well as commercial auto insurance, general liability insurance, workers' compensation insurance, for any on the job injuries that any of our employees might encounter. Through the Department of Motor Vehicles, all of our staff will need to be issued a driver's license if they don't already have one. That needs to be in good standing. Also, also our professional licenses that will be required include a licensed medical director. For me, as a nurse practitioner, I would also need a license. Any of our registered nurses will also need a license in good standing, as well as IV training and certification. All of these professionals will also be required to have malpractice insurance. So the overall budget for the business will be starting off by taking a loan from the bank while also having a down payment of $50,000 to $75,000. The startup budget for a 1-year period is $150,000 to $250,000, and the cost of each IV hydration session is $399. This brings us to a revenue potential of $175,000 to $1 million, and we will be making a potential profit of $61,000 to $300,000. Our average expenses for a 1-year period will be typically around $70,000 to $90,000, not including any staffing expenses. These are references, and to sum it up, I hope that you'll consider helping me start this IV hydration therapy business venture, and that way we can educate the public regarding any benefits that IV therapy has compared to traditional oral supplements that they might already be taking, and that way together we can improve the overall health of the Central Valley. Thank you for your time.